The federal government says it is set to introduce the human papillomavirus vaccine into Nigeria's EPI schedule as part of efforts to reduce the burden of cervical cancer in the country. The project, which is anchored by the National Primary Healthcare Development Agency, is in two phases, with the 16th phase one state expected to begin in September 2023. Aisha Salu reports that stakeholders are recommending the provision and distribution of free vaccines at primary healthcare centers for girls aged 9 to 14 years. The report.
Cervical cancer is the only type of cancer caused by a particular type of the human papillomavirus. It ranks as the second most frequent cancer among women in Nigeria and the second most frequent cause of cancer deaths among women between 15 and 44 years of age. The HPV vaccination is said to prevent more than 90% of cancers caused by HPV from ever developing.
This advent of human papillomavirus vaccine, especially the quadrivalent and even the night one, this is also very, very good because it's going to be a game changer to prevent the incidence of cancer of the cervix in the environment.
The vaccine is targeting children aged 9 to 14 years before their sexual debut. Now, as a sexually transmitted infection, the HPV is very common, such that by the time people are in their adulthood, many people have been exposed.
The vaccine protects against some forms of HPV. There are other types of HPV. There are over 14 types that cause cancer. The vaccine prevents against 4 or 9 depending on which one that you use. So by using the vaccine, you potentially remove the kinds of cancer that those ones can cause.
The disease is, however, said to be one of the most preventable cancers among women if detected early, as routine screening is believed to drastically save lives.
You could go testing. If you test and you have not been exposed to these cancer-causing serotypes, you can take the vaccine. But then you would have to pay. This one that we are ruling out is for the children.
But if we source it ourselves and purchase, definitely they are going to pay, but not at it is going to be pocket friendly.
Screening must still continue, just in case a woman is exposed to other types of viruses not prevented by the vaccine. So has the virus started causing some problems on your cervix? If it has started causing some problems, it doesn't go into cancer straight away. It starts causing little problems which can be treated in under 10-15 minutes.
High-risk HPVs cause about 5% of all cancers worldwide, with an estimated 570,000 women and 60,000 men getting an HPV-related cancer each year. In Nigeria, with a population of nearly 200 million people, complex diseases such as cancer are currently emerging as critical healthcare priority, but low socioeconomic status is associated with increased incidence of and mortality from cervical cancer. Aisha Salihu, Trust TV News, Abuja.